So I keep having, on a daily basis, patients walking in having massive questions about mold or mold possible symptoms, mold triggered symptoms. And as a clinic that works with a lot of different patients in the functional medicine community with Lyme, with pandas, with autism, I like to get a broad base of information out there to help you to deal with all the questions that you're having every single time a patient comes in. It triggers me to think, how can I help educate more? So here we go. Some bits and pieces about mold I put together on another video talking about what mold is, how it affects your body, and a little bit of what you can do to help your body. But on this video, I want to talk a little bit more about diagnosis and what you can do in your home to help your body and to help yourself get away from that mold. So here you go. The first step of figuring out about mold is identifying it in your home. So if you're starting to see some film or some black or even greenish color growing on a wall, growing on the outside of your home, that could potentially be mold. So we need to make sure and get rid of that. And if you see it, we're gonna have to start testing for it. How do you test for it? So you can go out online and do some shopping. There are little petri dishes that you can order that you can put in your home, and if anything grows on it, you can get that cultured and you can find out if it's mold. Other ways you can do it, I've had to buy a home before and I had a dog that was trained to smell mold, and that was pretty amazing because they really truly did find mold in the home I was looking at, using the dog to go around and smell for it. Another way is they do bring other types of testing into your home, different sorts of ventilation systems or other petri dishes, so that they can test your home and see if there's mold growing there. So those are a few ways that you can test your home. Now, if you find it in your home, you've got to get it removed. Just simply throwing bleach on it is not enough. So you've got to make sure that you have it professionally cleaned and removed and then retested afterward to make sure that you've got the job done properly and that you're getting the mold out of your home. Because that is the number one thing you can do if you have mold infection or mold sensitivities, or you've got to get it out of your home. All right, the next piece of the puzzle that comes along with that is once you know that it was in your home, we've got to get you tested for it. So if you're having mold symptoms, some tests that you can run, there's a lot of different laboratories out there, but there's mycotoxin tests. Now you can do them through the urine, which seems to be pretty effective, but you can also do where they go into your nose and you actually swab to see if there's mycotoxins in there. If there are mycotoxins in your nose or in your urine, you've got to start treating. That's on the other video, using some different binders and different other types of liver support and drainage support to get your body moving forward. So again, we can do urine, we can do swab tests to find out if you have mycotoxins. We can also get your home tested through a few different methods, whether that's the dog, the petri dish, or ventilation systems. And if you think you're having symptoms and they find out that through the testing you don't find it, that is not always the final answer. So much like Lyme, it's difficult to test for. There are a lot of false negatives. So if your body is really sick and inflamed and you get a negative test, but you're sure that you've had different types of mold toxicity, make sure you keep fighting, keep looking, or maybe even start treating just to see if you have some relief. And treatment is not overnight. It's over a matter of weeks and months. So it's not something you can just go ahead and start right today and go, yeah, it worked by tomorrow. You've got to put your time in. Healing mold sickness, healing Lyme, healing PANS is a truly marathon-like treatment plan. It is not a sprint. So buckle up, stay consistent. You can get well. I got well from Lyme. I feel great every single day. I am recovered. So just keep on pushing.